All right, good morning, good morning, good morning. Happy Friday, and yes, it is beautiful today. So I'm sure next week it'll be freezing and snowing. That'll be our luck. So it is our Leadership Day away today. I have good news and I have bad news. Which would you like first? So our main speaker was gravely ill today, so he could not come. His name was Simon Cooper, and he was an executive with the Ritz-Carlton. Dr. Tom DeMarco was picking him up in Easton and saw him. He wanted to be here, but Tom said, you really can't go because you'll probably be admitted at some point during your session. So he will not be here, so we're going to reserve him for a later date. We were looking very much forward to seeing him. The good news? Yeah, we're not going to fill the spot. We're just going to get out a little earlier. So, how about the jeans thing? Is that okay? Wow, we are hitting it off already. We probably should do some work today. My boss is in the front row. I do want to welcome Mr. Herb Geary, our chairman of the board. So welcome, Herb. Awesome. I forgot to tell him it was jeans today, so he got all dressed up. So we'll do our usual. We'll do a little bit of introduction, and then I'll do some system updates. Not much happening in the system, so that should be pretty short. Kidding. But first, a little bit of welcome. So, we have like a whole cohort of new leaders here, so we're going to kind of break them up a little bit. So, Carol Adkins, Megan Caton, and Bridget Devaney, are you in the room? Stand and please be welcomed and recognized. Awesome. So Carol is our pediatrics clinical supervisor. Megan, who's been with us for a number of years, was elevated to the assistant director of the foundation, and Bridget is our clinical manager for 5 Layfield. So that's awesome. Okay, and our next little group here, Eddie Downs, Tennille Gear, Sarah Greenfarb. Are you in the room? You have to stand. I see you. You got to stand. Okay, cool. Awesome. Welcome. Sarah's going to be a billing supervisor. Tennille, 5 East clinical supervisor. Is Eddie here? Yeah, I want to give a shout out to Eddie and a couple of other folks as we go through this process. Is Scott Phillips here? Scott's here. Scott, Eddie, and a number of folks, our environmental team. If you weren't aware of this, our linen plant, the one where we get our linen from on the west side of town, had a pretty significant fire, multi-million-dollar fire. And these folks have gone above and beyond to completely change our linen. So instead of getting laundered 3 miles west of town, it's now getting laundered in Baltimore, I believe. And Eddie was promoted to linen and waste supervisor. And if you know Eddie, great guy. And he and many others, knock on wood, have managed to keep linen flowing. Is linen pretty important? Yeah. So if you see Eddie, when you see Eddie, he's not here because he's probably back at the hospital doing linen. Please give him a shout out and a thanks because he and the team have done fabulous, fabulous work. So thank you. All right, next group. Diane Harrison, Joni Laird, and Michelle Maiden. Are any of you here today? Awesome, there's one. Welcome. Diane from ED Behavioral Health. Joni is PRMG Neurology Clinical Supervisor. And Michelle, RN Community Case Coordinator. Great stuff there. And finally, a couple of other pictures. Maria Tawes, Michelle Warren, as well as Katie Dennis, Jessica Haddock, Megan Keene, and Christina Springle. Are any of you here today? Oh, stand to be recognized. There you go. I see Michelle. Awesome. Wonderful. So welcome to the group. Welcome here, especially during breaks. Seek them out and get to know them, and that'll be great. A couple other folks we want to take a few minutes to talk about. One is Kim Billingsley. Are you here, Kim? Oh, stand up and be recognized. All right. So we have to talk about Kim's role for a couple minutes. Mary Williams, stand up and be recognized. Awesome. So at some point, Mary's probably going to retire, maybe next year. Who knows, quite honestly. But it's such an important role that we wanted to make sure we had a nice overlap from a transition perspective. So Kim Billingsley joins us after spending 30 years? 30 years up at Shore Health. And so she did all kinds of great work up there, and Mary is thrilled to have her here. So they're going to be a fabulous team. Because guess what we have this year coming? Joint Commission, exactly. So perfect timing. So it's great to have her. And Mary is one of those folks, quite honestly, I always feel better when I'm being tested by people like regulators and stuff. I feel great when Mary's in the room with me. So I'm sure we'll feel the same way about Kim. But thank you, Mary, for how many surveys now? 18? And that includes disease-specific? 5 this year. So awesome. So like I said, we're not sure when Mary's leaving. It'll probably be next year sometime. We're going to make sure she writes our action plans with Kim this year. So, but thank Mary, because she has been such a tremendous asset. And like I said, I know when I get tested by these folks coming in, it's always nice having Mary as a part of that process. So thank you. All right, another promotion. Angie Brittingham, where are you? There you are. Welcome. In a new role. Awesome. So this is part of the evolution within the nursing division. So Sarah's been doing such a great job, and Angie was our interim ER director and has been elevated to that position full time. So great to have you. How's days working out for you? It's a change, yeah. Angie was a night owl, so she transitioned to days during this process, and it's great to have her in the role. Awesome. And we already saw her pulling names out of hats or numbers out of hats. So I want to officially welcome Dr. Karen DeBerry to the executive team at Peninsula Regional Health. Yeah, that was quick. So clearly I did not ask about her favorite sports team early enough in the process, because I found out the other day it was the Patriots. I'm like, oh my God. Is it the Red Sox too? And we still get along. Okay. But Karen comes to us from the Guthrie Clinic. We are extremely excited to have her here. I know the PRMG team is excited to have her here. In her previous role at Corning Hospital, she spent half her time doing CB-like work as the chief medical officer, and the other half of her time she was responsible for the Guthrie Clinic's Western Division of primary care physicians and supporting that team. So we're excited to have her as our full-time vice president of PRMG and our chief physician executive of the enterprise. PRMG is going to have some significant evolution over the next couple years. One of my goals has always been to regionalize our physician enterprise, and when I say regionalize it, grow it and have it cover a larger region and even more hospitals. And we're excited to have Karen take us on that journey with the support of her team, as well as with the physicians in the enterprise, because really one of the main goals in that process is to get them engaged in actively leading and supporting their enterprise, and I know that's something they're looking forward to. I told her when she came here there was about 100 providers in PRMG. I forgot to tell her about Nanticoke has another 50, but we'll get to that. So. All right, so at this point, I want to invite some other folks up on stage, if you wouldn't mind, or maybe we'll take the microphone out front. So at this point, Cindy, we'll do some Sunshine Award winners. Would you like to come up? Okay.
Is it this one? Yes. All right, very good. All right, it's always a pleasure to talk about our team and the exceptional care that they're providing every day at the hospital. So first, we'll talk about our Sunshine Awards. Back in October, we celebrated Selene. Selene works on 5 East, and she speaks Creole, and that's one of these languages that sometimes it's hard to get folks that know Creole. And she speaks fluent Creole, and we had a patient in the hospital who was in critical condition and feeling quite alone. And so Selene actually left her unit, went to the unit that this patient was on, and comforted her and calmed the patient down. And the staff on 3 Layfield were very thankful to have Selene come over and help with the patient. Also, in the right-hand corner, you see Vasa. Now, Vasa is a CNA, and for 3 nights, she took care of a lady who admittedly, in her write-up of Vasa taking care of her, was painful. She said I was in pain, I was grumpy, and I just was not, I took a lot of V's time, so I wasn't a very easy patient to take care of. But that didn't faze Vaza. All throughout her shifts, she was just compassionate and caring and always smiling. And she says all the nurses and CNAs and techs took care of me very nicely, but V was my bright and buoyant angel. So when you see Vasa around on 5 South, congratulate her. And you can see that smile. You can imagine why folks think she's bright and buoyant. And then Rebecca Whitten from 5 East, we recognized her in January. She works tirelessly throughout the day. And no matter what you ask her to do, she finds the time to get it done. She doesn't do what she does looking for recognition. She really wants to help her patients heal. She makes a huge difference in the lives of her patients and her coworkers. So congratulations to Rebecca, who is one of our Sunshine Award winners. And you know, our CNAs actually, we realize they have more face time with the patients than our nurses do, than our physicians do, and other members of our healthcare team. So we're really working to strengthen our CNA pool. Okay, so the Daisy Awards, these are for our nurses, and in October, we recognized Steve Mears. He's one of our nurse practitioners, and we recognized him for listening and connecting with the patient and then digging deeper to find a rare diagnosis. And this patient owes, he said, his increased quality of life to Steve's effectiveness as a practitioner. So congratulations to Steve. And then in December, we celebrated in labor and delivery, honoring one of our long-term nurses, Jackie Crockett. And one of Jackie's patients was pregnant, and she was preeclamptic. So she described how scared she was and uncertain about what was going to happen to her baby, maybe, and to her. But her presence with Jackie being there gave her confidence, and she knew that she could trust Jackie to take care of her. And she said, I knew that God had sent me an angel to watch over me throughout my hospital stay. So congratulations to Jackie for a great job in labor and delivery. You know, they deliver about 2,000 of those little ones every year. And then finally, Celine, in the right-hand corner there in January, we honored Celine. And, you know, sometimes the best care is really caring, you know, helping patients and families accept the dying process with dignity and with comfort. And so that's exactly what Celine did. And the granddaughter of this patient said she treated us with the utmost respect and care. And she said on one day, I showed Celine a picture of my grandmother when she was well. And the next morning when I came in, she had washed my grandmother's hair and did the best she could to fix it to look normal. So on the day that her grandmother passed away, though, Celine was not her nurse, but she said she kept coming back, checking with us. She prepared us for what was to come, and she stood by us during those difficult times. And when they left the unit on the day that Grandma died, she offered her condolences, hugged them, and had tears in her eyes. And the granddaughter writes, this wasn't a show. This just wasn't her job. This is her passion. And she says, I'll never, never forget Celine as long as I live. We'll be indebted to her. So thanks to Celine for creating those memories that are going to live on in this family's history of their grandmother passing away. So we have some fabulous folks, all of you in the room and the folks who are back at the hospital taking care of our patients. So it's always a fun thing to go out to the units and recognize those who have been recognized by their patients and their families for the exceptional care we provide. So thank you, Steve. Healthcare heroes, yes. We're going to have, yes, Sarah. Sarah Arnett, where are you, Sarah? We have some heroes, too, to recognize. You know, our Heroes Awards are those who, actually, we find stories for folks who go really above and beyond. And Sarah has such a story to tell today.
Good morning, and I have Kelly Wilson and Lori Summers coming up with Amy. And is Mike here today? Did Mike get invited? Mike? Okay. Come on up, Mike. Okay. So we love to recognize our healthcare heroes, and what I'm going to be reading to you today was actually written by Lori. Lori is, if you don't know, Lori is our manager of 3 East. Kelly is our director of Med-Surg, and Amy is a nurse on 3 East, and Mike Mason's one of our PAs in the hospitalist program. So Lori wrote the following to recognize Amy and Mike. So when one thinks of a healthcare hero, the first thing that comes to mind is someone who prevents an error or saves a life during an emergency. That is not always the case. Life with cancer isn't easy to navigate from a patient, nurse, or provider perspective. Each day can bring a new challenge, and there are few definites. Hope is a blessing, but it can also be a curse. On 3 East, at the time this was written, they had 2 patients, very different, but yet similar. One is a female that was admitted with stage 4 endometrial cancer. She was very young, in her early 50s. The second was a gentleman admitted with a rare aggressive form of multiple myeloma, and he too was young at only 42. Clinically, both patients were failing, and they knew that caregivers knew that their time was short. Both patients also presented with very challenging family dynamics. They required countless visits and consults, had all the appropriate providers, palliative care, pastoral care. Everyone was sharing the same message, but both patients and both of their families held steady in their belief that they would be cured and had chosen to remain full codes. There were no effective treatments left to offer either patient, and concerns crept into the minds of staff that the care was becoming futile. The patients were suffering, and many of them knew that it was almost time for the patients that would be calling a code blue. So they discussed both of those patients in their daily huddles, unsure of what to do next and how to secure a realistic plan for these families and patients. So when Lori wrote this, both patients were progressing through their disease process and were felt to be in the early stages of active death. Mike had been attending for one of the patients and the medical attending for a second patient. He knows the patients well and had been very honest and open with them throughout their stay. Mike uses language that's easy to understand and continues on a daily basis to reaffirm the reality of the situation without making them feel inadequate for their beliefs. Mike kept an open line of communication with the nursing staff, the oncology providers, and the patient's healthcare power of attorneys. Excuse me. Today is ending differently. Mike had to share the worsening news, and both parties were overwhelmed, and some of them were angry. Amy, who is lovely, was our charge nurse today and was caring for her own group of patients when the patients were progressing and had to hear the news that they were not doing so well. While she was not the primary nurse for the patients, she knows them both very well due to the amount of time they were on 3 East. She has an uncanny knack for knowing when someone needs to talk and when someone is ready to listen. She stepped into both situations today and sat down with the significant other of the male patient, holding her hand. Pardon me, this is difficult to read sometimes. Holding her hand while the providers shared the bad news. She offered support and reassurance while the decision was made to make the patient, you're not resuscitate, I'm sorry. It was during that time that the patient expressed her wishes, the other patient, to become a DNR and receive medication to make her comfortable. When Lori wrote this letter, tomorrow in Huddle, we will be able to report out that both patients and their families had decided on comfort over suffering. Their lives will not end in the ICU, and they have a saying on 3 East that is actually very lovely. They share this with their patients on a regular basis. You do not have to give up hope. Your hope looks different. While we no longer hope for a cure, we hope for time together with family that is peaceful and free of pain. I truly believe that Mike and Amy were instrumental in providing support necessary for both patients and their families to find the strength not only to make the decision, but to be at peace with that decision. So thank you. And we have some things for you. Don't go anywhere. Oh, thank you. To honor and recognize them, we have a couple things for each, for both Amy and Mike. They get a Healthcare Hero pin, a Healthcare Hero medal, and a certificate of appreciation. And I'm not sure what's in the envelope. So that's yours. You're very welcome. And thank you all for all you do, and I apologize for the tears.
Who else gets to support a team that does, quite frankly, amazing things? And I think as leaders, that's one of the things that I'm so proud of, is we get to support folks that are doing this type of stuff each and every day. It just blows my mind, quite honestly. So thank you and congratulations, and thank you for being here and part of the team. Maybe we should take a break. No, I'm just kidding. Thank you. Okay. Wow, it's all down here after that. All right. All right, the recognition is not done with the amazing group we have. Employees of the quarter, Bonnie Dean, Melanie Rivers, Carol Moran, and Danica Rogers. So as you see them out and about, please give them a shout out as well for the great work that they're doing. Want to take a few minutes to introduce some new team members from a provider perspective. I think it's always good to kind of put some names with faces out there. So I might ask Simona to help me out on some pronunciations. But we have Dr. Masood, who is a new hospital. Well, he was our physician of the quarter. I'm sorry. So great job there. As well as Barbara Manry, who was one of our CRNAs with a nurse practitioner. Okay, we should get that. But with Peninsula Surgical, so we'll have to get that updated. Some new providers, Dr. Ashfaq and Austin Peterson, who's a nurse practitioner with pulmonary, as well as Susan Vieira Candela as a physician assistant with CV surgery, and I think she comes with experience, if I recall correctly, so that's great to have, and Mary Horner with the hospital group. And a couple other folks who are new to the team, but not necessarily new faces. Dr. Ron Travitz joined, awesome guy, joined Peninsula Regional Medical Group as a family practice provider in Salisbury, as well as Joe Morris as a nurse practitioner with family medicine. So some great additions to the team there. We continue to be a place that I think providers want to be a part of, and I see that only continuing to grow. So some other announcements and some other recognition. So here's some fun stuff. Mother baby Yvonne Hops for 39 years of service. I guess, where's Diane? Yvonne retired, so awesome there, as well as Pat Oberholzer retired in the lab, so thank you to them. Now some news, say it isn't so. Apparently Craig Copenhaver wants to retire, folks. So Craig's another one of those folks that I have to say, I'm just curious as leaders, how many times have we had to lean on Craig? Who has ever had to lean on Craig in this organization? He is one of those folks that, quite honestly, some of the stuff we do when supporting the effort isn't always the most fun, and this is definitely probably one of those areas. But if you think about what we've had in Craig, he's one of those people that, I always feel better when he's helping me or has helped me and or others through a process. And I can tell you, this organization is going to sorely miss Craig Copenhaver. And if we could give Craig, as this being his well, maybe, we just might not approve this. But anyway, I guess there's some things I have to do. But if we could give Craig that recognition he so deserves. We'll talk, Craig. Okay. Some other stuff that's been going on in the health system. Sexual orientation and gender identity questions are now a part of registration. So as you know, as society evolves and as medical capabilities evolve, we have to become better students of what's out there and what presents. And there's questions now asked as a part of registration. And I want to give a shout out to the effort that it took to implement something like this. Where's Teresa Niblet? Every time this topic came up, I have to say Teresa was there. And honestly, I'm not sure the entire team structure, because I know registration also was very much involved, as well as our nurses and so forth. So I want to give a shout out to the whole team that has been a part of this. But I got to tell you, every time the topic came up, it was Teresa that was there really championing this along with others. And I want to thank the registration staff and others who, again, it can be awkward. It's new. It's an evolving process and so forth. But it's important. It's very important as folks have healthcare-related needs that we truly understand what they're bringing to the table and where they are in life. So I want to give a shout out to Teresa and the whole team, especially registration and others that have contributed to making this a success. So thank you, Teresa and team. All right, next person. Is Dr. Wiseman here? He's back taking care of providers, getting them straight. Okay, Dr. Mark Wiseman, want to create some awareness out there. He was in Becker's with a little bit of a Q&A. So if you know Dr. Wiseman, he's our Chief Medical Information Officer, and he has one goal, and that's to make providers' lives easier when it comes to Epic right now, picking up the reins from Chris, who's transitioned to lead our patient safety efforts in the organization. So I want to give a shout out to Dr. Wiseman because he really is helping our providers kind of get back to taking care of patients, and really how can the EHR support them in that effort. So he's doing a great job. A little bit of awareness, if you didn't see this, I know there's been questions about this. I had questions asked of me on rounding about Teladoc. Are you guys familiar with Teladoc? We all got little cards, right? Was it a little card we got? Okay, awesome. So Teladoc allows us to use telemedicine and actually engage a provider, I guess through an app. I haven't used it yet, but that's a benefit that we now have as a part of our new benefits program. And I believe it's free to the team, correct? We get charged a little bit for it, but we think it's well worth it. So it's free to the team to use that service. I will tell you, we're always a little apprehensive about these types of things. We actually did question them. We actually asked them for, what's your antibiotic prescription rate, on some of these types of things, because we want to be appropriate with the medicines, as well as providing that that guidance from a physician, and it seemed like a very worthwhile, appropriate service. So we're excited to add that into the portfolio. Yes, of course. For the prescription. Awesome clarification there. So dermatology, a little bit of I think I'd rather pay the $25 than wait for the dermatology. How long do you have to wait for a dermatology appointment these days? I think that's a deal, Ken, but thank you for raising that. I guess we've updated the dress code. I was talking to Mitzi the other day, and I'm like, can we do anything different on Fridays, like letting the team wear scrub patterns and stuff like that? And she tells me we're already doing it. So must have missed that one, but that's great to hear, because I do think it helps the team get a little bit more engaged. So first we had costumes for Halloween, then apparently we have sweaters. So that was kind of a neat thing. Really some fabulous pictures out there, but honestly, this one really strikes me. So where's Deb, RJ, Robin, and Ray? Are you in the room? Stand up and be recognized for actually coming to work with this on. That is fabulous. All right, another thing around the holidays that we had was bell ringing. So let me tell you, thank you very much to the people who contributed over, Karen, help me out, 200 hours? About 200 hours? We pretty much doubled our time with the Salvation Army, and I think that was a great cause. And this little guy's name is Barbara Llewellyn's son, Connor. So he was a prize-winning bell ringer. So I have to tell you, I noticed that when I bring my children, people tend to donate more. So that's an important strategy. Nothing better than a little kid with a bell, and this one's even better because they got dressed up. So is Barbara here? Awesome. How cute. Very nice. So if you volunteered for that, again, thank you. The community is indebted, and those funds go to a great purpose here in the community. Some other stuff that's out there. 64 slices was apparently not enough for an ER CAT scan machine. Now we've got 4,300 and some odd slices as a part of this. So where's Mary Lou? Does that really help? I'm just kidding. So we are putting in a new CAT scanner, and it does have roughly 320 slices. Our radiologists are so much more busy. We also had to clone Dr. Riccio and create more of him. So I'm not sure, but Ray's probably going to ask for more disk space at some point, right, Ray? You're going to need more hard drive support for all these things. So little shout out to our pastoral education grads. We have a strong pastoral care program here, and I think it's worth mentioning. Is Joyce here? Joyce and the team do a great job. And we just heard some really compassionate stories about our clinical team having really challenges, and they do a great job supporting these various transitions. I want to give a shout out to the pastoral care folks, because they're equally important in really helping people through these processes and supporting their spiritual needs. And Joyce and the team do a great job, and it's hard training pastors for this service, and we definitely appreciate the work that all of you are doing. Another new program out there is we launched a care transitions program. So Fiddler, we're calling people, right, after they're discharged from the hospital. This is important stuff. Everybody has an interest in keeping people healthy and well these days. It's like the vogue thing to do. And I know we have providers calling offices, now providers calling patients, the hospitals calling patients, and we probably still have some work to do on really getting it clean and efficient and effective, but given the challenges that we have, it's probably better we're doing more calls than less right now. So we do have phone calls after discharge for our patients these days, to ensure that they have what they need. We get an understanding of what happened with the hospital and what we can do better. So we're pretty excited to see how that helps potentially with our readmissions and care transitions and getting folks into an appropriate provider while getting some feedback on their stay at the hospital. So that's neat. We also had another annual, another program celebrate an annual event, and that was our STAR program. Where's Diane again? Diane, special treasures are remembered. Yeah. So, I'm not sure if everyone's familiar with this. I actually, I wasn't until, where's Bo? Bo and I had to work with a father who lost a child a number of years back, and really gave me insight into how valuable, not everything goes like we want it to go up on mother and baby, and labor delivery. And there are passings, and this program is out there to help parents cope and really network with others and really support them during this time. So my first exposure to it was several years back with a very challenging environment with a father who was going through that coping process in his way. So I guess it was the 20th annual service, Diane, for that program. So good stuff. And just kind of keep that in the back of your mind. 99.9% of it's wonderful news, but that team up there also has to help with, on occasion, things that don't go as well as everyone would like. Probably beating a drum here, but I guess it's flu season, so I always want to give a shout out at this meeting especially, because I know the clinical folks all over the place are really handling what is always increased census, and as well as patients, it's our team, quite honestly, going through people getting sick. If it's running through your houses like it is mine these days, thank you for that extra effort. Thank your teams for that extra effort, not just taking care of the patients, but also trying to stay healthy and well ourselves. Other thing with the holiday, there's Matt. Whoa, big Matt there. We helped adopt 109 families. We should invite Greg to this meeting just because he's Greg. I mean, really, I know he's not seriously, can we do something about this, Tom? Because Greg, as our elf, how many people saw the video this year? All right, awesome. They do a fabulous job. Just keep in mind, whatever they tell us to do at the exec table, we do with these things. We don't think of these things. I just want to let you know that. But it was great to help adopt 109 families for our at the holiday time for those who perhaps would benefit from it. A couple other last things that we did here is we actually renamed some roads on campus, and I can't think of a more fitting honor. We renamed Bryan LeCompte Way. Bryan LeCompte was the champion behind the donation of the Waller House and ultimate upfitting of that house to become our new foundation home. And Bryan LeCompte has spent countless hours, lots of dollars donated to this house, both by Bryan as well as the various contractors in the community. It's pretty amazing. I don't let my wife go there because I'm afraid she'll actually see what's possible, and we don't want that. We did take the time to honor Bryan with naming the road right next to the Waller House, Bryan LeCompte Way. The other road that was recently named, and I can't think of a more fitting honor, was Dr. Nevin's Todd Way, which is the main road that goes right through the campus. This is the guy I talk about in orientation who, quite honestly, in combination with a couple of others, Dr. Buchnis, Dr. Don Woods, these are the guys that transformed this hospital back in the early 70s and put us on a path to where we are today. And I can't think of a better way to honor Dr. Nevin's Todd with naming the road on behalf of him. I mentioned the Giving House, so they did move in. And then finally we had our Bring a Toy to Work Day. So thank you for the folks who continue to support the Brooke Mulford Toy Cabinet, because I know Angie and the ER folks, it's an important, it's a great legacy, but it's just to be able to support kids coming through the ER. All right, couple other recognitions, then we'll wrap up. Sarah Luttrell. Dennis, where's Dennis? Is he at United Way meeting? All right, so Sarah was recently appointed to the Mortality Quality and Review Committee for, check this out, as a Developmental Disabilities Administration psychopharmacologist. What the heck is that? All I know is it's really impressive, whatever it is, but apparently she's representing the pharmacy community on this important committee that studies something that's really complicated. So give a shout out. What's that? She's appointed by the governor too? Wow, maybe she can get me in with him to talk about funding. So, but if you see Sarah, thank her, because that's some pretty amazing stuff. And then finally, Diane Hitchens had a presentation recently accepted to the Sigma Theta Tau International Honor Society of Nursing, the 45th biannual convention. And I can understand this one. It's Couplet care from the start, never apart. And that's really reflects the great work that our labor and delivery, who, by the way, was a top 5 or 10% for Healthgrades recently. That'll be talked about at that Healthgrades thing that we can't talk about, I guess. So congratulations, hats off to Diane for some great work in Mother Baby. Okay, and our last big photo is Wear Red Day. It is Heart Health Month, and we were able to kick that off. I am the person with the blue shirt and the red tie all the way in the background. So anyway, I don't have a red shirt. Some people have red shirts. Where's Bo? He's got Roger has a red shirt on. I guess I got to get one of those things. But thank you for coming out, and thank you for supporting Heart Month. As Roger mentioned, we have the Healthgrades Announcement on February 12th. This is a continued testament to the great work that folks are doing. The entire team, not just the folks who take care of the patients, but all the folks who support the people taking care of patients. We did get another year of affirmation of that great work with a number of different accolades. And apparently there's a big national award that we can't reveal yet. All right, I'll keep it embargoed, I guess. I probably should. So that is Thursday, February 12th from at 11 a.m. down in Hollowell. So if you can come by, swing by, and share in the recognition, and I guess have some ice cream after that. The other thing that we did find out that is not quite a fully baked methodology, and I know it has some trouble nationally speaking, but that 5-star thing from CMS, we're pretty sure we got that as well again. And but again, Healthgrades is a little bit more developed. CMS keeps kind of redoing stuff, but some great work there. What I don't want this to take away from is I'm going to kind of do some system updates now. That's kind of the recognition. I don't want to take it away from our scorecard, because while we have some red on our scorecard, some of it's red because there's some stuff we can't do and we just have to deal with. But we are doing some great work, but I will go over kind of where we stand. Maryland hospital-acquired conditions. These are the potentially preventable complications, the things that in theory should not happen in hospitals. We are in the red for that. There's probably some stuff. We've had a couple things happen that shouldn't happen, whether a patient falls and maybe fractures something, maybe a retained sponge, something along those lines. There's been a couple of those, and that doesn't help. But I think more of the issue is we've got some understanding as far as how the system and coding process works that we're trying to further understand. When you go from, quite frankly, 5 stars and top 5% in Healthgrades, and you see something like that around the exec table, I can tell you, we believe it's probably more though of a data issue than necessarily the quality, although I don't want to minimize the fact we can always get better. So we're doing some work there. CB and others are leading that effort. Potentially avoidable utilization is a measurement that is both readmissions and these things called PQIs, prevention quality indicators, which are things like CHF, diabetes, things that in the community, if we handled it better, folks wouldn't be admitted to the ER. So we want to do better in the community. But when they come to the ER, we kind of get dinged on them. So that number is a little higher than where we want it to be. Readmissions is looking really good right now. There's been a lot of effort around that. I know a number of people have been involved. The PQI number has gone up a bit. And my challenge with this measure is it's one of these measures where, guess what? We probably started out better than we should have. And we got a little worse than where we started out. And they want everybody to get better no matter where you start out. So even though our readmissions is better than the average, even though the readmission number is counted in the 5%, the Healthgrades thing, it's counted in the 5-star for CMS, we started out so good, and they don't take that into consideration. They just say you kind of got to get better no matter where you are. So just kind of keep that in the back of your mind. Readmissions looks great, though, right now. I know we're going to be really focused on CHF, diabetes, stuff in the ambulatory world to keep people out of the hospital. That's probably going to be the focus going forward. On the service side, I think these are doing better than these might actually reflect color-wise. I know we're slowly trending up on HCAHPS, which is nice. I know Cindy and Sarah and Kelly are working on really standardizing some processes on the floors, especially around providing patients information, the multidisciplinary rounding, working with the hospitalist and Dr. Ng. So we're very optimistic that's going to continue to trend up. The PRMG provider number has gone from red a couple years ago to consistently yellow, and even now I think it's even in the 60s, which is great. Our practices are doing a fabulous job on the outpatient side. Which is wonderful to hear. Our GI practices, I'm looking at Carla who won the bag, our GI practice is constantly fighting with endocrinology for the #1 slot, so I think they go back and forth there. Employee engagement, it's red because that's the last time we measured it. So 31st percentile, and physician engagement was the 21st percentile. I'm optimistic. We did some midterm surveys. The physician satisfaction number, we're pretty optimistic is going to go up. It's going to take a bump there. Dr. Ng, Sylvia, and others, the medical staff officers, have really taken this to heart and have done quite a few things to move that number up. I'm cautiously optimistic the employee engagement number is going to be heading up. I will say it was interesting because Simon Cooper was rounding. Where's Mitzi? Was rounding with you, right? Yeah, and he was kind of scratching his head. I don't think he understands why our employee engagement is where it is, and we do all these amazing things. So we're working hard to figure that out. We know a lot of that, and Mitzi's going to talk about it in the next section, is compensation, benefits, and those types of things, and we are trying to figure those out. From a financial perspective, Bruce is here, right? Where's Bruce? You ready to do your report? I'm sorry, I didn't tell you about a report. It's okay. We'll keep it pretty brief. We're tracking to probably do a little bit worse than break even right now. Right now we had a good first quarter. Second quarter's a little bit low. The state's doing their normal thing to us, which isn't always fun. But we've also had some expense creep. We are focused on providing some stability. We want stability in the operational area, so I know we're tracking higher on temp labor, because we don't want people not to have what they need to take care of patients, and that's causing a little bit of the red. With all of the stuff going on with these mergers and affiliations, as you might imagine, the lawyers are getting their fair share of these things, so that's also creating some challenges. So I think this year we're probably not going to hit break even. We're probably going to be red to some degree, but there are quite a few one-time things hitting our way. And finally, on the ACO population expense, this is one that we could probably spend a whole nother hour talking about, but quite a few system issues there, but I'm not going to go into it in detail. I think we understand what it's going to take going forward to really restructure our clinically integrated network on how to better manage the populations outside, and ultimately that'll also impact the prevention quality indicators. So this year was, I think, kind of a learning process and really understanding the data. And then finally, affiliations and partnerships is yellow. I'm not sure why it's yellow. We've got a few of them going on that we're now going to talk about. So I'm going to pause for water. All right. I can't really recall a more active 3-month period since we started this when it comes to the health system. If you remember at the last day away, I had a couple of parting messages or a couple of themes. You guys remember any of them? Was one around meetings? Yeah, so I could probably go around the room and see who canceled the meeting. I canceled some meetings, but then we decided to merge with some other hospitals. That created more meetings. I talked about us needing to create an environment that people want to be a part of from a regional perspective. One of our goals going forward really needs to be how do we transform our hospital into a health system. We do that for a few different reasons. One of the main reasons is collectively by coming together we can take better care of the population because we do have a lot of overlap between the different entities out there. We also do it because coming together allows us to be more efficient and effective. So one of my goals has been how do we create or how do we transform PRMC to kind of be a magnet that people want to be a part of. We did that really well because in the last 3 months, people want to be a part of us. So I think that's a testament to what didn't happen in the last 3 months, quite frankly. It's really what's been happening the last 20 or 30 years as we've evolved and really have established everyday events and taking care of our patients that I think truly now people want to be a part of. So the health system, we're very early on. Nothing's definitive, but I can tell you, as you know, Nanticoke signed for a letter of intent. We'll talk about that. McCready's under a letter of intent. And people do want to come together with us, and we should be extremely proud of that. I'll talk about McCready first, the current status of McCready. So we're under a letter of intent with them. That letter of intent has been in existence, I think, since last, Herb, we both signed it. It's been months, right? Spring, summer, July. So we know what we want to do in Somerset County. Okay, we want McCready to come underneath us. I'm going to get really detailed now because I think everyone having an understanding will be helpful, especially with where we're going. So McCready Foundation is a hospital. It's an assisted living facility, and it's a nursing home, all under one corporate umbrella. The hospital has, as you might imagine, an emergency department. They do some surgery, and they do inpatient work. They don't do enough surgery and inpatient work really to be viable as a hospital. They have about 2 patients overnight is their average daily census, so there needs to be some pretty significant change with that portion of the structure. They have a nursing home and an assisted living facility. They struggle a little bit too. They have about 70, 80, 90 beds. I'm not sure exactly the number, but they at best break even. Where we're going is to bring McCready into our system as is, while we help them evolve to a more sustainable form of healthcare for Somerset County. And what does that sustainable healthcare look like? It's something called a freestanding medical facility, an FMF, okay? Have you guys seen like freestanding ERs, right? If you drive up towards the Bay Bridge, right, there's a freestanding ER there. The benefit of these structures is that the entity maintains some rate-regulated support. In other words, what they charge, people have to pay, kind of like what we do on campus here. Because the reality is if they didn't have rate-regulated support, it wouldn't be a viable entity. So we want to help McCready transition to something in the future. We've worked it out. We've got the vision, FMF. We actually bought a little bit of property down there. It was really cheap. We didn't want to tell them it was for us. That way it was really cheap. And we have the vision. We have a definitive agreement. We have a plan. It's all ready to go. But Bruce and I are in negotiations ongoing with the state about how much money they need to continue giving McCready to have an appropriately sustainable enterprise down in Somerset County. So those negotiations have taken, quite frankly, longer, and they've been more painful than I could have predicted. I guess I should have realized it was the state. So we're working through that process, cautiously optimistic that something's going to happen in the next month or two, at least in terms of figuring out what direction this is going to head. Let's be optimistic, half full, and assume we get what we need. What's our plan? We're going to continue operating them as is while we build a new freestanding medical facility not in its current location. Have anybody been to McCready? What do you have to drive over to get to it? And what happens to that bridge when it rains? Yeah, it floods. That whole area floods. So we decided it's probably not good to build a new building on that island. So we bought some land on the way into town, 10, 15 acres. It was really cheap. Once we bought it, by the way, that guy spilled the beans to the whole community. I just sold land to PRMC, and forget it. The communication was out of the bag. So we're planning on building this freestanding medical facility on that piece of land. It's going to take, Tom, 2 years to build, 18 months to 24 months to build. Apparently, you still, even though you're inland, you have to bring in a lot of dirt, okay? So we're going to run the hospital as is for the next 2 years. They're struggling, quite honestly. They're struggling because they've got instability. Their team doesn't know what's going on. The community doesn't know what's going on. And we're going to need to, assuming we head down this path, kind of support them. So we're about to enter into, I believe, a management agreement for them, which means that a few of their senior folks are actually going to be in this room probably next time we meet as part of our team. It would be the CEO, the CFO, and their nurse leader. Because what's going to happen is Cindy is going to put together a team, and we're going to get like this with them to help them through this process, because it's a little bit of a vicious cycle. If they don't have stability, they can't see patients. Where do those patients come? Here, or worse, nowhere. Until when? It's bad. So that's part of our issue, is we need to keep that engine going down there and servicing the community, because if we don't keep the engine going, guess what happens to the discussions that Bruce and I have to have about support? They get harder and harder. So part of our need over the next several months is going to post some FTEs, hire some people, and help their team become more, keep the engine going. We're probably going to look at policies, procedures. Welcome, Kim. We're going to be down there looking at Joint Commission. They're going to be part of our hospital at some point in time. So we're going to be really getting into that process. So 2 years while we do this process. Once we open up the freestanding medical facility, it's an emergency department, it's x-ray, it's a small lab, it's some physician offices, behavioral health, and rehab. I think that's all of the areas. It's not surgery anymore, and it's not an inpatient hospital at that point in time. So want to be transparent with the plan, because we want everybody to understand what we're trying to do there at this point. We'll continue operating a nursing home and an assisted living facility down at that site. That's important for that community, because there's 71 patients in that nursing home right now that would have nowhere to go unless we help through this process. So that's McCready. All right, the next one, Nanticoke. This is a copy of their website. I was going to wear green today. I actually had a green PRMC version of these, but I was like, wow, that'd be a little... Anyway, so if you notice, Nanticoke explores affiliation with Peninsula. So Nanticoke, and I think we really should be proud of this, quite honestly. A couple things I want to talk about. The selection. This was an 18-month process on their part, and not something we could talk about. They were, during that time, they were very, and continue to be, but now that it's out, we can comfortably have more conversations, both here and between our organizations. They were very concerned about things getting out, because when things getting out that you're looking for a partner, things tend not to go well. So they spent 18 months going through this process. I forget the number of facilities that they started with when they put the RFP out back in the spring of last year, but it was above 10, I believe, but I just forget the exact number. More than 10 health systems. Some of the, all the usual suspects, as you might imagine, Delaware, basically all of Delaware probably. A couple of national, at least one national for-profit organization. And ultimately their organization went through a selection process to say, who do we want to be a part of? And I'm happy to report the news is out. Obviously they selected us. And I think we should all be extremely proud for the reasons that I talked about. What was interesting is I can also tell you who we were up against. The final two was Christiana. And I'm not going to lie to you, I feel even more proud of all of you and our team, because Christiana is a behemoth. And we did well versus Christiana, so we should be really proud of that. Why did they choose us is a good question. Why? Well, right across the border. No, that's not the only reason. It was all about culture and what we're doing from a healthcare perspective. And when they interviewed our team, we had a vision for what we could do together, and that's really two hospitals. I'm not discounting McCready, but McCready's different. But it's really two hospitals coming together to form a new system on the Delmarva Peninsula, and that hasn't happened. I'm not sure when the last time it's happened on the peninsula. It might be Kent General and Milford forming Bay Health. But we presented a vision to them of two hospitals coming together for those reasons that we talked about. How do we provide better care to the community? How do we perhaps share some expenses and become more efficient and really do better together in our region? So culture was the number one reason. Vision was number two. And we did better than all other folks. And then they had some other stuff as well. A couple rumors that are out there. Not-for-profit hospitals don't buy other not-for-profit hospitals. That's not the way it works, so we didn't buy anyone. What happens is we, as a part of this process, we do make certain guarantees that we commit to, and that's committing to their sustainability for a period of time. That's what we do. For-profit hospitals buy not-for-profit hospitals, but that's not us. It is a membership substitution. That's kind of the formal term. We're using the word in the community affiliate. Honestly, it's just when you try to explain membership substitution, you're like wasting your time out in some ways. Not with you guys. What that means, though, is that they become part of our health system. So the Nanticoke Health Services becomes part of Peninsula Regional Health System. That's how we get multiple hospitals. So what's going to happen over the next several months? That's what I want to spend a few more minutes on, and then we'll wrap up. We have a formal process we have to go through. The letter of intent was signed last week, Wednesday, I think it was, the 31st, and that is it's non-binding. So this is, the deal's not done until it's like closing on a house. Until you close on it, it's not done. But we have a non-binding letter of intent that outlines our relationship. Our relationship predominantly is outlined as we're going to come together, form a new system. We're going to be doing some restructuring from a governance perspective in that process. We have to go through this process called a due diligence, and that's where we request all kinds of information on McCready. And we have a team of people that will evaluate that information. I'm sorry, not on McCready. We already did that on McCready. Now we're doing it on Nanticoke. The joke is that these things are going to close on the same day. Is that right, finance team? Is that the running joke? Yeah, it very well may be. But we have to go through this due diligence just to understand what we're getting ourselves into. It's quite complicated. We actually are bringing in a firm to help us do that because I've abused the team enough and we need help at this point in time. While we're doing the due diligence, we have to do a definitive agreement. That's kind of like the contract on a house. It's really the document, the contract that says here's our commitments, here's what we're doing, and so forth. Fortunately, because we've been through this with McCready, we actually have some understanding of what that looks like, which is kind of nice. So Bruce and I and Mary Ann will be kind of charging through that definitive agreement process. And then there's the regulatory process, and this is the big unknown. There's a Maryland hospital that's merging with a Delaware hospital. Honestly, when's the last time that's happened? So we have to go through certain things at the federal level, as well as certain things with the Delaware Healthcare Commission that we're just uncertain of the time frame. We know due diligence will take probably about 120 days, about 4 months, maybe a little longer, a little less, depending on how things flow. It's this regulatory one we're just not quite sure about because it just hasn't happened. My speculation is it'll be either really easy or take forever. It's going to be somewhere in between that. And really easy could be we close on this thing in the late summer. Taking longer could be next January. It's difficult to tell. So until that happens, we're kind of working through the process while also going through some informal relationship building. And this is important because we're not merging two hospitals. Two hospitals are becoming part of a system, but we are becoming part of a family. And we need to help folks through this process. As you might imagine, it's probably unnerving for the folks up at Nanticoke. I get a lot of questions. What's going to happen to my job? What's going to happen to services? And those types of things. So it's a lot of FaceTime with different folks that's starting up to kind of share what we want to see from a vision perspective. I'm going to go back 2 slides. So what do we want to see from a vision perspective? We want to see Nanticoke do well collectively with us doing well. We want to see them do things that they can do well while sending us stuff that we do well that they probably shouldn't do, like open heart procedures and some of the other really complicated stuff we do here as a hospital. We want to continue getting that type of stuff from us. If they had chosen another organization, about 21% of our volume comes from lower Sussex County. That would have been a problem for us because we would have had that volume perhaps go to Christiana or somewhere else. So we really want to continue getting the stuff that as a tertiary care center we do, and we do well, but we also want to see Nanticoke do well. We want to see new programs start there. If there's patients who need and are from that area, we want to see them get their services there. And that was part of the vision that really resonated with them, in that they weren't just going to send the mothership all of their cases. No, we want to see them do whatever it is they can do and grow more volume there that's appropriate for a community hospital. And that's kind of the relationship building that I'm working through, and I have lots of help in this process. CB, Simona, Tony Aginola, and I met with their medical executive committee this week to kind of start allaying some of that anxiety. I have a collective desire to go back to the eastern side of Sussex County. Is anybody from Millsboro here? Millsboro, yes, great. Why Millsboro? Well, we got into Millsboro many years ago because remember what percent of our volume was from Sussex? 21%. It's actually about 24% of our revenue. Why is it more dollars than cases? Because it's the complicated stuff that gets referred to us. It's the open heart volume, it's TAVRs, it's all the stuff that we want to maintain. So we have a desire to go back and reevaluate our Sussex County strategy. And now that Nanticoke is in play, we're going to do that as a health system. If all of that volume came to us, what would happen with our Maryland GBR? Who knows, honestly. I just have no idea. I don't think we could say anything, quite frankly. But with Nanticoke, guess what? We can grow volume up there and send Nanticoke the stuff they should do and do well, while continuing to ensure that that tertiary complicated stuff comes here. And that's the vision that they really like to hear, that quite honestly no one else could tell them that. But because we're in Maryland, that's our world. So that was very helpful. So what that looks like, we don't know yet, but that's the relationship building, really is giving people a comfort that their world is just not going to stop. They're going to continue doing great things up there for the benefit of their community. Hopefully we can get some more volume. Why is Sussex County important? I went to a presentation that Bill McCain did this week. He does these annual economic presentations. They're starting 150 new homes a year in Wicomico County. Guess how many they're starting in Sussex County? Shout out a number. 2,500 per year. 2,500 single-family homes are being built per year in Sussex County at this point, and we're, so when you think about volume and growth, that's important. So now here's where it gets to kind of the tricky part for us. We've never built a health system before. Herb hired me knowing that I've never done this before too, so that's kind of entertaining. But the reality is, we talked about this a couple years ago. This was one of my goals, was to how do we have local consolidation. I didn't want to achieve the goal in the first year. I really wanted to spread this out, by the way. They came to us, but that's just the way it works. So we are going to have some help come in. We're not sure who yet, but to help come in and walk us through that process in a way that makes sense, not just for PRMC, not just for Nanticoke, but for the benefit of a larger integrated system. In other words, somebody to help set this up so that we are ensured that we do achieve some of the benefits. Okay? If we continue running both hospitals the way they're both being run today, guess what? We'll just get by. That's not what we want to do. We don't just want to survive, we want to thrive. So we're going to bring somebody in to help us go through that process. It's not going to be, it will be intrusive in many ways. These folks are going to ask us questions. They're going to interview people. They're going to interview people up at Nanticoke. They're going to go through what's called like a functional assessment, where they will go through and do an inventory, interview everybody up at Nanticoke, all the different departments, and guess what they're also going to do here? Same thing. And that can be uncomfortable as well if you think about it. And you're like, oh, Steve, nobody told me that we may be impacted by this. Well, that's kind of what I'm sharing right now, is that process is really designed to help us become stronger and better as a system. And it will have us ask questions that maybe are a little uncomfortable, but I think in the long run are important to really ask so that we collectively do well. I'll give you some examples so people kind of don't freak out. When you become a system, sometimes services are spread from one location throughout a region. I'm going to take IT for an example because they just love more work. Unfortunately, it can't happen on day one, but usually when an Epic facility affiliates with a non-Epic facility, guess what happens? Yeah, it's like the Borg. I mean, the Borg, you remember the Star Trek, the Borg? We come in, and they're eventually on Epic. So that's probably going to happen at some point, but it's probably not day one because they're on Cerner, and they have a long-term contract with Cerner. So even if I wanted the IT people to go put up Cerner, guess what? They have a long-term contract, and it's like 4 years, 5 years left. So that won't happen. But other services, there might be opportunities for efficiencies. I'm looking at our PRMG friends, our physician enterprise. Steve Rose had an issue last year where he was down 2 medical oncologists. He's down to. He's like, he calls me up. Can you help us out? Well, we checked. None of ours have Delaware licenses, so that's a little bit of a problem. He ended up having to get a locum. Well, if we're more integrated, what does that mean? We can share resources, between the organization. Our lab probably has more specialization than their lab. So maybe tests get sent down this way or vice versa, whatever it might be. So those are the questions that we're going to probably ask as a system. At some point, we'll probably be on the same payroll system. That's a natural type of thing that systems do. So this company that comes in, yet to be named because we haven't selected them, will help us go through all the functional areas and develop a plan for what has to happen at closing, and then what is like our 3-year plan to really transform Peninsula Regional Health System from us to really something that services the region. So I've told you all I know at this point in time. So that's kind of where we are. My main goal for this is to have this be smooth, especially on day one. There are other people in the region watching this unfold. There are other hospitals that may be independent, I know, that are watching this unfold and looking at us and how we work with Nanticoke and saying, okay, well, maybe that might be us one day. What's it look like? So we want to make sure we continue to be really good neighbors during this process. We help them out however we can because, trust me, all eyes are on us, hint, hint, to the east. So, all right. There's a bucket in the back of the room. Bucket. It's like a tray. It's got like stuff. Yeah, you can write questions. I would encourage you. Last quarter, we did a survey, and I guess people liked asking questions. I don't know why. So I'm committed to answering anything, and try to put some humorous ones in there too. One person put one humorous one in there, which I liked. But especially on Nanticoke and McCready, after lunch, we'll ask questions and have an opportunity to kind of peel it back, plus whatever questions you might want to ask, just kind of like what we did last time. We'll take a few minutes after that. At the end of the day, I want to remind folks why we were selected. We're doing amazing things that we should be proud of, and people want to be a part of that, which quite honestly is what makes me incredibly proud about supporting the entire team here, is because we are doing amazing stuff. We heard about it on stage today. It's out there. There's stories all the time about it. And guess what? People want to be a part of that, including other hospitals. And I think our future is tremendously positive. So with that, we were going to dive right into it. But I think what we'll do is we're going to take a break before Mitzi's presentation. Again, Simon Cooper was going to be here, so we've adjusted the agenda a bit. So Mitzi's going to go next. So we have a break right now, so maybe 15 minutes. You can add questions in the back, and we'll huddle back again. Thank you all.